And this will be our video for week 1. The objectives for this week are that you will be able to define the terms health, community, community health, population health, public health system, and global health. You will be able to discuss the five major determinants of health, list and discuss the factors that influence a community's health. We'll talk a little bit about governmental health organizations, and I will provide some examples of each. We will also discuss the 3 core functions of public health and talk about the 10 essential public health services. Just to remind you, the items that are due this week are the online scavenger hunt, the Cook County Department of Public Health brochure. For this, you will be creating a brochure that highlights the services at the Cook County Department of Public Health. You will brainstorm ideas for your advocacy letter. There will be a short quiz on chapters 1 and 2 and your discussion board. For the advocacy letter, I'm going to bring you to Blackboard really quick to show you where to find the instructions for this assignment. When you get to our Blackboard page, go to Course Materials, and then click on the Advocacy Letter Information folder. This folder will bring you to the sheet that discusses the description for the advocacy letter. This letter is due the last week of class, but I am breaking it up into smaller portions to allow you to start working on it throughout the entire semester, which is 8 weeks. So the purpose of the advocacy letter is to connect what we're learning in class to a real-world situation, to allow you to collect and analyze data at the community health level, and to create an argument to how to improve that community health problem or health issue. For the how, you will research things at school, the community, state, and nation that affects a person's health. And then you will come up with ideas how to improve that health. Ultimately, I want you to pick a topic that you're passionate about, so you have some interest in the research. And then the what, and this is what you will be handing in. Your product will be a letter that's addressed to a person who is able to help with the health problem you've identified. Examples could be a CEO, an elected official. It could be someone at the Cook County Health Department, a local governmental agency, but one person that you feel you could make a difference with. In your letter, you need to define the health problem. What do you see as the cause of the health problem? How does it affect the community? What are some changes or outcomes that you would like to see? And in this area, you can provide ideas for how to improve the health problem. And then how will these changes help health outcomes as a whole? This is the rubric for the advocacy letter. And then down here, I've provided an example of a health advocacy letter to help you get started. So again, for this week, your job is just to think of ideas of what you would like to research for your health advocacy letter. And that would be over here where you brainstorm. Back to our PowerPoint. So this week, we're going to be covering chapters 1 and 2. Some of the major achievements that the 20th century has had in regards to public health are vaccinations, motor vehicle safety. Think about not only seatbelts and airbags, but how cars are designed to take in impact. The control of infectious diseases. There has been a decline of deaths, especially in the US, from CHD, which is cardiovascular disease, and strokes. That we have healthier mothers and babies in the US. And that means that more babies are born alive and healthy, probably due to prenatal care, and that we have technology and tools and education to help pregnant moms and then postpartum moms be healthier. We have safer and healthier foods. If any of you have read The Jungle, which is about the meat packing industry, you will know that our food is a lot safer now. We have safer workplaces, We have tools for family planning, and so that includes access to birth control, information about birth control, and abortion. We have the fluoridation of drinking water, although there is some controversy about whether or not this is truly an effective product. So all of our water that comes from the tap and comes from the city contains fluoride in it. However, there's some research that suggests that drinking fluoride does not really improve the health of our teeth. And that there has been a recognition that tobacco use is a health hazard. And as a result, cigarettes have gone down. However, with the increased popularity now of electronic cigarettes, tobacco use in that form has gone up. We'll cover a few definitions in this PowerPoint. So health means a lot of things to a lot of different people. But for the purpose of this course, it is a dynamic state or condition of the human that's multidimensional. And so really it includes our physical health, our environmental health, our emotional health, our mental health, our financial health, and things that we interact with in our environment that creates us as a well person. When we talk about community, it is defined as a group of people who have a common characteristic. So this can be defined by location. So for example, I live in Fox Lake, so Fox Lake can be considered my community. It could be considered race, ethnicity, your age. We tend to be friends and close with people who are similar in our age group. Our occupation, so my colleagues, my faculty, or an interest in a particular problem or outcome, or just common bonds. So it's characterized by a membership. So you feel as you belong into that community. Sometimes there are common symbols or systems. So if you are part of a men's group, I think it's Kiwani, they have a special symbol to show that you're part of that membership, that there are some shared values and norms. There's mutual influence, so you influence them and they can influence you. There are some shared needs and a commitment to meeting those needs and a shared emotional connection with those around you. Other definitions include public health. And public health are actions that society takes collectively to ensure that the conditions in which people live in can be healthy. And so it's a very inclusive term that can include lots of different aspects in terms of policies, actual living environments, health clinics, and so forth. When we talk about community health, this is the health status of a defined group of people. So even though public health includes community health is more narrowly focused. And then last is population health. And population health are the outcomes or the health outcomes of a group of individuals. When we talk about global health, these are really health problems that are worldwide. So there are no boundaries. And it's really important to focus on global health just due to international travel, right? So people are interacting with people from other countries all the time. We think about major airports and health outbreaks that happen there. It really shows us that we are a connected global society. So we need to talk a little bit about the difference between what are some personal health activities and community or public health activities. So personal health activities are my own actions and decisions that impact my health. And they can be influenced by my family and my friends, but really it's the choices and decisions that I make. That's a personal health activity. When we look at community or public health activities, those are really activities that are aimed at improving the health of a particular population or group at a much broader level. Some examples of community or public health activities are maintaining birth and death records, protecting food and water supply. I mean, think about the last romaine lettuce contamination, right? So they pulled all romaine lettuce from the shelves and from restaurants and so forth, and that was done to protect public health. Factors that affect the health of a community it's multidimensional, it's interconnected, and so they include gestational endowments, social circumstances, environmental conditions, and that can include air quality, just having access to health and medical clinics and medicines and healthy foods. Our behavioral choices, whether or not we choose to smoke or use alcohol or illicit drugs, medical care. So not only the quality of care that we have around us, but access to that quality of care. So all of these really impact a person's health and the health of a community. Other factors are geographical. So what is around us? Do we live in an area that has a lot of violence? Are we, again, close to medical clinics? Do we have access to healthy foods and fresh foods? Same with our environments. The community size, how many people are in our community and how many people are we focusing on? And industrial development. When we look at social and cultural factors, so these are communities in general's beliefs, traditions, and prejudices. It includes our economy. What is the financial health of the community? Are they low income, high income, in the middle? Politics, do they have an influence with their politicians? Religion plays an impact, and generally having a strong tie to religion is connected with better health outcomes. Social norms, so what are the norms of the community? Is violence accepted or is safety accepted? And then socioeconomic status, which are really all the factors above, right? It has to include with money, but along with income and status, people are afforded more better health outcomes that would include, excuse me, access to fitness centers and daycare. And so we generally see that people with higher incomes have better health outcomes. So when we think about individual behavior, it really takes the concerted or the combined effort of many individuals to make a program work. And this idea is herd immunity, that the resistance of a population to the spread of an infectious agent is based on the immunity of a high proportion of individuals. So what we see is that more people are non-smokers, that behavior tends to influence other people not to be smokers. The greatest health achievements in the 21st century include reductions in child mortality, so reductions in childhood death, vaccine preventable deaths, so people no longer die from polio and measles. We have access to safer water and sanitation, malaria prevention and control, and these are from a global perspective. Prevention and control of HIV/AIDS, tuberculosis control, control of neglected tropical diseases, tobacco control, global road safety, and improved preparedness and response to natural disasters. Now we're moving on to chapter 2. So over the past 100 years, communities have taken lots of actions to deal aggressively with health issues continuously. So 3 classifications of community health based on funding sources, responsibilities, and organizational structures are governmental, quasi-governmental, and non-governmental. When we look at governmental health agencies, these could be either from the federal, state, or local levels. These are primarily funded through our tax dollars, and they're managed by government officials. They have authority over some geographic area, and there's 4 levels. There's international, national, states, and local. International health agencies, one of the largest ones is the World Health Organization, or WHO. The headquarters are Geneva, Switzerland. There are 6 regional offices around the world. It's not the oldest health agency, but it is certainly the largest health agency and probably most respected. When we look at national health agencies, each nation has their own department or agency within its government that's responsible for protecting the health and welfare of the citizens. In the US, our primary health agency is the Department of Health and Human Services. But other agencies also contribute to our health, which is the Department of Agriculture, the EPA, OSHA's Workplace Health, and the DHS is Department of Human Services. The Department of Health and Human Services in the U.S. is headed by the Secretary of Health and Human Services. It's appointed by the President and is a member of the Cabinet. It takes around 25% of our federal budget, so this is the largest department in the federal government. New healthcare reform law provides a series of new duties and responsibilities for the Department of Health and Human Services, and there's 11 operating agencies and 10 regional offices that fall under the Health and Human Services umbrella. All states have their own state health departments, and the purpose of these state health departments are to promote, protect, and maintain the health and welfare of their citizens, the health and welfare of our citizens. It's usually headed by a medical director who's appointed by the governor. And their purposes are represented in the core functions of public health, we'll get to in a few minutes. Many state health departments are organized into divisions or bureaus. As you can imagine, states are pretty large, and so you do need to separate and make smaller units. But they play many different roles. They can establish their own health regulations. So for example, in Kane County, you have to be 21 years old now to buy tobacco products, whereas federally the minimum age is 18. So they've created their own policy to help reduce tobacco. There is a link between federal and local health agencies, and they also help distribute federal funds aimed for local health departments. And so they're the ones that determine how the funds should be used, what purpose should they be used for, and what is the ultimate goal. And they also have laboratory services available for local health departments. When we look at local health departments in Illinois, they are divided by the county. So we have our Cook County Health Department. The jurisdiction often depends on the size of the population. So again, in Illinois, it is based on counties. State mandated services provided locally. And so through them, they are the ones that go to restaurants to make sure the restaurants are sanitary and clean and the food's healthy. They help maintain public buildings. They are the ones that oversee public transportation. They detect and report certain diseases that they feel they need to collect on, and some vital statistics, which are like death rates and birth rates and mortality rates and things like that. In the US, there's approximately 2,800 local health departments. And lastly, the organization of local health departments. You have your board, and then either a health commissioner or sometimes it's called a health officer who's a physician. And these are separated into different components. There's one unit that looks at communicable diseases, one that looks at chronic diseases, one that looks at vital statistics, a nursing department, health education, and environmental health. This is the end of the week 1 PowerPoint. I would encourage you to go flip through the chapters 1 and 2 in your textbook just to get a little more information of the topics we covered today, and then go ahead and get started on creating your own public health brochure. You are to do it using the Cook County Department of Public Health website. And don't forget to take the quiz for chapters 1 and 2 and do the discussion board. As always, I'm available to you if you have any questions. Don't hesitate to send me an email or give me a call. I'm really here to support your learning. Have a great day.